When will COVID-19 go away? The World Health Organization is now saying it may never go away, and it's warning against trying to predict just how long COVID-19 will keep circulating. John Northcott has more on the words that are pretty sobering from the WHO, John.
Yeah, it's pretty stark, Heather. No promises, no dates. This coming from the WHO in terms of what our expectations might be right around this planet in terms of when coronavirus might be effectively dealt with or might miraculously somehow just go away. The WHO coming out and making those comments. Let's listen to Dr. Mike Ryan.
I think it's important to put this on the table. This virus may become just another endemic virus in our communities, and this virus may never go away. HIV has not gone away, but we've come to terms with the virus, and we have found the therapies and we've found the prevention methods, and people don't feel as scared as they did before.
So Ryan talked about the false equation between having to measure off the success or interference with the economy with trying to stop the spread of the virus, saying it would require a massive effort around the world, as if what we have done already is not massive, but in terms of governments and cooperation. So if that is to be the new reality, Canadian researchers already coming to grips with that, and we talked to one on CBC News Network a few minutes ago. Have a listen.
I think this is really confirmation of what we've been suspecting for some time now. Once a new virus really escapes containment, it's going to be nearly impossible to put that genie back in the bottle. We've only done this once in history, and that was with smallpox. Once we have an effective therapy and/or vaccine, we should be able to mitigate the severity of COVID. So it is still in the community, but we are less concerned about people requiring hospitalization or intensive care units.
So much discussion, John, about the race for a vaccine. What did the WHO say specifically about that?
Well, again, not overly optimistic, pointing out that there are some 100 efforts or more around the world, clinical tests as well starting. But let's listen once again to Dr. Mike Ryan.
But someone's got to make it, and we've got to make enough of it that everyone can get a dose of it, and we've got to be able to deliver that, and people have got to want to take that vaccine. Every single one of those steps is fraught with challenges. We could, with a massive moonshot, will turn maybe what has been a tragic pandemic into a beacon of hope for the future of our planet.
So there it is, massive moonshot, their assessment as to the quick success of vaccines. Also, again, if there is a vaccine, and this needs to be underlined, then you have to get it to people and you have to make sure that they take it. There has been a vaccine available for measles for years. Still, several 100,000 people around the world die every year simply because either they were unaware or they did not have access to it. The challenges, Heather, in all of this don't go away.
John, thank you very much.